Hello, my name is George Wanamaker. I'm a physical therapist at Presbyterian Village, and this is a continuing series on back care and maintenance. The topic for today is walking and the benefits of walking on back pain. Um, there's a couple important factors to consider with walking. One, do you have the strength and the activity tolerance to walk? Two, if you're walking, should you use a cane or a walker or something to help your posture and stability? And three would be the frequency and how far, how long, how much. So we'll dive into some of these topics. But first, I always like to overview of the spine, the regions of the spine, just to provide some context to what we're talking about, and to give a visual of posture and the impact of some of these things that I'm talking about on the back. So if you can see my picture here, all of these images I've just Google searched and borrowed. But you essentially, you have five, but essentially you've got four main regions of your back. You've got your cervical, which is these first seven vertebra up here, starting at the base of the skull, and then going to there's a pointy region. If you take your fingers and run them down your back, and then it comes to a point. That's approximately number 7 here, or right in the transition area. And then you have your thoracic, which is your big trunk region. This picture is pretty good because it shows the chest reflected here. And the thoracic has 12 vertebrae. It goes most of the way down the back to about the middle back region. If you put your finger sort of in the middle of your back, you can appreciate where the thoracic region ends. And then you've got your lumbar region, which is the problem that most people encounter. These are big, thick, heavy vertebra and heavy discs because they have to support the weight of all your organs and your top stuff up here. So they have to be inherently a little bigger. And because they're supporting all that mass and over the course of your lifetime, have to go through a lot of repeated movements and compression, they take a lot of abuse. So people typically have problems in the low back region here. And this goes to about, if you feel where the bony parts of the top of your pelvis are on the sides, just slightly below that is this area. Hopefully you can see my cursor here on the screen. Where I'm going back and forth here is about where the tops of your hip bones, your tops of your pelvis would be. So it's just a slight bit below that. And then you've got your sacral region down here. These are essentially the same basic concept of these stacked elements, the vertebrae, but these are fused down here in the bottom. So that gives you just a general context of the spine. This picture has pretty good postural alignment. You can see there are four, well, there's really five, but there's four basic curves to the spine. There's a concave curve normally up here in the top of the neck. There's a convex curve naturally in the back. And then in the low back region, there's a concave curve. Again, remember this aspect, this concave curve, because we'll talk about this again in a minute. And then in the sacral region, there's a convex curve. So also what you need to know is gravity is constantly acting on our bodies. The force of gravity acting on our mass and the density of our bodies is constantly providing a compressive force through the axis of our body. So if you can imagine, there's a line drawn approximately here, and we're naturally designed to maintain our posture in response to that force of gravity. So there's a different line axis going through here, and based on the musculature attachments, they help support some of these structures and maintain upright alignment. As we age, as our bone density goes less, as our muscles become weaker because of a sedentary lifestyle, if we don't have good mobility during the day, which is the point I'm harping on today as far as getting up, moving, and walking in particular, because this particular discussion is about walking, we lose some of the ability to maintain our upright alignment. So when we talk about walking, we have to talk about sitting too, because sitting is what we spend a good portion of our days doing. And if you remember back on the other picture, I talked about the curvature of the spine here. So normally it has this concave curvature, which allows for improved alignment, but also there's different structures here that are nervous tissue, nervous meaning your nervous system, each nerve's coming out and supplying your vital organs, supplying your musculature so that you can move. Normally, there's a certain curvature that allows for good posture and good alignment and room for these structures to work properly. However, when you're sitting, particularly if you're sitting in a flexed posture, this curvature flattens out a little bit, which then can put a lot of pressure on the discs, and can then in turn put pressure on your nerves and put strain on your musculature. So hopefully you can appreciate when you're sitting, this curvature is flattened out, which then your discs are like for lack of a better analogy, a water balloon, and they push. If you push on one side, it's going to push the fluid viscosity towards the other side, and then put a lot of pressure on the back of the spine, which is where all these nerve tissue and everything comes out. I don't want to talk too much about that because I've talked about that in other lectures, and we'll review it, in previous lectures and then in the future. But what I'm trying to get is the importance of maintaining, at least periodically, good upright posture and moving, allowing these structures in the low back to go through their normal mobility, to have good relief so that they're not putting prolonged strain and compression on some important structures. We'll come back to this picture. So I just want to talk, and I've got a little bit of an outline here, talk just briefly about what are some of the benefits of walking for back pain. There's a caveat to this. If for some reason you have a surgical reason or some sort of injury where walking is contraindicated, of course, you shouldn't be walking. There's inherent safety risk there. However, for people with normal mobility, with not life-threatening conditions, I would say take some of these things into consideration as far as daily mobility, moving, stretching, and getting up and walking to tolerance. So an important thing to consider, and I'm going to go through in an outline format, is walking helps to strengthen the muscles in your abdominal muscles, your low back supportive muscles, some of these that are finely closely associated with the back, the muscles in your pelvis and your hip, which again all help maintain that good upright posture. You're also working a little bit of the supportive musculature that helps with breathing, because when you're walking, I'm going to tilt the camera a little bit. You've got to use some of this abdominal and supportive musculature to the rib cage for when you're increasing the workload of walking and your breathing. You've got to use some of these musculature to expand and contract. And when you're walking, that helps improve your cardiopulmonary system by strengthening those muscles repeatedly. So it has a secondary effect on your health by improving the cardiopulmonary system. But it also helps strengthen some of these supportive postural control muscles. This picture, multifidus is just a small, but it's throughout most of the back, associated muscle that help maintain good upright structure and postural alignment. With this picture, you can't really see, but hopefully you can appreciate along the whole back, there is a gap between the spine and between this outer cartoon line. All along this line is associated musculature, and there's two basic layers. And walking helps through mobility and through use helps strengthen that to help with your posture, which in turn helps provide some relief on these vertebrae and these discs, and then in turn again helps provide relief to some nerves coming out either side. Walking also helps with fluid circulation. Fluid circulation is important because your bone and your discs and your nervous system relies on good, healthy blood supply. One, to bring healthy nutrients and oxygen and other important elements that help the cells within the disc, within the nervous tissue, within the actual bone to rebuild and reconstruct and maintain good cellular health. But also, these cells have a certain metabolism within themselves, and they have bad metabolites and bad things that can build up and become toxins if they're not flushed out. So the actual act of walking helps to increase blood circulation and help to remove some of those toxins, particularly from the bones and the associated structures and cells of the discs and the nervous tissue, so that these toxins don't build up and then break down these structures, so that you have better spine health. One of the ways that this happens is the actual act of walking and using your muscles provides a muscular pump on your veins and the other tissues that are associated with your vasculature to pump some of these metabolites away from the spine, away from other associated structures, and helps pump some of the good stuff in so that you can have good cellular metabolism and maintain spine health. Another important aspect that walking helps with is joint mobility and flexibility. Let's go back to this other picture. Well, yeah. So between each vertebra, there are a couple of actual joints. The spine is not one solid structure. It's made of many stacked bone elements that have joints between each bone that help slide and articulate on one another. One, so you can have good forward and back movement, but also some rotation. And if you're not up and moving and walking and using these joints, they can break down, but they can also become real stiff because even though these are bony joints, they have some associated capsular tissue and soft structures that if you don't move them, they don't have the same elasticity, and they need to be stretched, or else you'll be really stiff, and thus leading to reduced mobility and bone breakdown and further tissue loss. So you need to be up and moving and have good joint mobility and stretching, which walking can help do. Another aspect that walking helps with is bone density. So I talked before about the impact of gravity on our system, and particularly when we think about gravity, we have to think about there's a constant compression force acting through our mass, which in turn, because of the way we're designed, acts through our entire spinal structure, because this is a supportive structure that has to bear the load. Excuse me. And with bone is a funny system, because bone has certain cellular structures called osteoblast and osteoclast. Now that necessarily is not important to know, but the more important thing is bone responds to stress and is layered in areas of increased stress or compression or weight acceptance. So by being up, being moving and walking and using your muscles, providing certain needed forces, and the act of gravity acting on the axis of our body provides just enough stress for bone to receive those signals and to lay down deposits where need be. This is particularly important in people who are have low bone density, whether you have osteopenia or osteoporosis. You really need to be up and moving to provide the bone with that adequate signal to lay down those deposits. If you're sedentary, if you're not moving, you're really not providing your bone with enough of a stimulus to lay down those layers, and thus it's going to take up the minerals further, and you're going to have further bone loss. So walking, moving, stretching is very, very important, particularly with people with osteoporosis and osteopenia. There's the phenomenon called Wolff's Law is that natural mechanism that the bone has for layering down in areas of stress. That's a very simplified explanation of that, but the important thing is that bone responds to stress and weight bearing and gravity. Another aspect that walking can help with is with your metabolism and with weight loss, or weight reduction even. This picture is good because it shows this frontal area is where most of your vital organs and your fat deposits will be laid down. And if you've got excess mass here, that mass multiplied by the force of gravity is providing a forward momentum force, which acting on your spine, which then all of your musculature and your bones and everything have to respond to, which puts a lot more stress on the system. So if you're up, you're moving, you're walking, and you're working on improving your metabolism, improving your at least a little bit of weight loss, you're taking less stress off of the system so that your bones are not as strained. Even though I just said that bone responds to stress, there's a failure point. And if your musculature cannot maintain your upright posture because they are so overstretched and overworked because of the excess mass in front, the whole system breaks down. So walking helps to increase some of that cellular metabolism and use of the energy deposits that you have and the fat deposits to keep the system working optimal. So some considerations with walking. Soreness post-walking, especially if you're just starting a walking program or just starting being more active, your body's naturally going to have some post activity soreness, which you should consider. Now, don't let that scare you from doing it again, because your body will naturally over time build up a certain accommodation to these increased needs of the system. But just be aware that you probably most likely will have some soreness, and just trying to maintain good blood flow, good mobility will help work out some of that soreness. If you don't have any contraindications like high or crazy blood pressure, any wounds or anything like that, you might consider like a heating pad or something post walking, particularly maybe a couple hours or so post walking to work out some of that soreness. But again, you may want to consult your doctor um, before implementing that, because I don't know personal medical history, and if you've got some reason why you shouldn't use heat, like a blood pressure issue or an open wound or something like that, you would want to consult your doctor. But using a heat pad would be a consideration for post soreness. Some other considerations: set yourself personal milestones, personal goals. Like, okay, today I'm going to walk for 5 minutes. And then once you get comfortable and tolerant of walking 5 minutes or a certain distance, I'm going to walk down the hallway and back. Work on achieving that goal. When you achieve that goal, move the marker a little bit further. Maybe I'm going to walk to the hall and then somewhere else, or just having a mindset of working towards a goal-oriented behavior. You're more likely to be consistent if you've got a personal goal in mind that you're working towards. Make walking social. The nice thing about a community like Presbyterian Village is that there are plenty of other individuals who have a similar mindset and who want to be advocates for themselves, for their own health. So walk with a friend. I know there's a walking club and other means, or maybe it's just, hey, we're going to walk down the hallway at 10 o'clock every day. Make it more social. It makes it an easier task to complete if you've got somebody else completing it with you. So just some considerations. Maybe it's your spouse. Maybe you say, hey, we're going to walk 2 times a day, in the morning and at dusk, or something like that. Just setting goals, and then so you're not doing it on your own, making it a social event so that you can keep working towards these goals and you have somebody motivating you and encouraging you. Another consideration is good shoes. We typically in the rehab world recommend closed-toed shoes with a back on them and with good rubberized soles. We're not necessarily a fan of Croc type shoes just because those have a lot of mobility in the shoe. They don't, the toe area, the toe box of the Croc type shoes, even though it has a back, is typically a lot more open. Open, not necessarily meaning the holes in the shoe, but just the actual toe area is more open, leading to a lot more mobility of the foot during its natural mechanics, which can increase a fall risk. We're not really a fan. I wouldn't recommend any type of loafer or slip-on shoes because they just don't have the support. Another thing to consider is if you have swelling in your feet, making sure that you've got a shoe that has enough elasticity or enough room in the shoe to accommodate for some of that swelling. Because you don't want to end up with a pressure injury or rubbing on your feet because your shoes are too tight. So just considering a closed-toed shoe with a heel and a good sole to provide enough grip, but also enough support. And then another consideration is stretching. Stretching, even just gentle mobility, stretching your legs, moving your back slowly through its natural movements in a sitting position prior to walking, helps to recruit some of those muscles that support your spine, but also helps the joints and the soft tissue structures stretch out so that you're not going to have as much pain when first standing because things are not moving as they should, but also allowing for adequate mobility to your joints and just prepping your system for walking. You could even consider stretching after, maybe when you come back from walking, sitting for a minute, because your tissues are naturally going to react and going to lose their elasticity a little bit as that reactive phase goes in from being worked. So post stretching is a good idea. I think the final consideration is even just a little bit of walking can help your back. Even if it's just for 5 minutes, setting a small personal goal and then working forward 5 to 10 minutes. Once you're doing well with that, progress a little bit further. Maybe you do for 15 minutes, or maybe you walk down a hallway twice, or some small milestone, some small goal, and then work forward. Um, so that's all for today. Again, this topic was about walking and the benefits of walking on spine health, not only on the health of the bones themselves by improving blood flow, by improving the loading response of the bones, but helping all the associated soft tissues like your muscles and the other joints in your body. Again, my name is George Wanamaker. I'm a physical therapist at Presbyterian Village, and this is a continuing series on back care and maintenance. Thank you.